welcome. We are going to talk about our third video in our series of 4 final videos for the ankle month, wrapping up January, talking about Achilles tendinopathy, how to eliminate it, and how to treat it. Okay, so we're going to really talk about how to eliminate it based on pain location, to be more specific here and in detail. Doctors will always tell you when you go to see them, rest it completely, take this oral prednisone, take this meloxicam, which is a muscle relaxant, take Advil till you feel better, but you never want to rest the tendon completely unless it's completely ruptured and you can barely take 1 or 2 steps. Okay, and if that's the case, you got to go get imaging and then get an MRI from the doctor and then figure out exactly what's going on and then deal with load management issues. All right, so really, what are we going to talk about tonight? We're going to talk about how your rehab plan needs to be set up strictly based on your symptom location, number 1, which we talked about last week. If you haven't seen that video, go back and watch that because it's a precursor and it's a foundation for what we're going to talk about tonight. Okay, and the other thing is exercise selection. So again, if you have not seen that video from last week, go back and watch that because we talk about mid-tendon injury, that portion of 1 to 3 inches off of the heel, insertional injury, where it's kind of right at the bottom of the heel, and then we also talk about having an injury around the peritendon, with that little sheath that kind of surrounds the actual Achilles tendon on the outer part of the ankle. Okay, so really this is important because what we said in last week's video, if I just had to recap really quick, is you don't want to stretch an insertional issue. So if you have pain and discomfort down towards the heel bone, or you have like a small kind of bone kind of sticking out like a loose fragment or something, you want to try and avoid stretching because it's going to irritate it. If you have a peritendon injury and you have that pain around the outsides, you want to try and kind of use a heel lift because the heel lift is going to take a little bit of pressure off, kind of take that heel upwards, put your foot in more plantar flexion, so it takes the tendon off of a stretch and lets it relax a little bit more to unload it, so to speak. Okay, so just remember that, go back and watch, it'll make more sense. All right, we're really talking about this because if you're not doing proper exercises at the proper frequency, meaning the amount of correct times per week, then you're going to stay potentially stuck where you are, or it's going to get worse and you're going to need surgery. So that's why it's such an important topic, okay? So we're going to talk about 3 phases in detail tonight. Phase 1 is decreasing pain with isometrics. Phase 2 is improving strength with isotonics. Phase 3 is recovering the spring-like mechanism of the Achilles tendon using plyometrics, okay? So a lot of crazy terms. Isometrics just means you're contracting the muscle without moving the joint, so like holding at the top of the range of motion of a heel raise. Isotonics just means like normal daily activity, where you have a shortening and a lengthening cycle, like doing a heel raise where you go up on your heels and come down. And plyometrics just means like doing repetitive kind of loading, right? Like a stretch shortening cycle usually is what it entails, like jumping in place, doing jump rope, doing a box jump, a depth drop, which we're going to talk about in a little more detail. Okay, so starting with phase 1, decreasing pain with isometrics. This is when a muscle contracts again, but that joint does not move. So it's like doing a double leg heel raise off the ground, holding your heels as high as you can, squeezing your calf muscles as much as you can for a set amount of time, which we're going to talk about. So research really shows that doing isometrics have a great potential to decrease tendon pain for about 45 minutes afterwards, as well as increasing your overall tendon strength. So that's why isometrics are so important, and they're a great way to start because they're not going to cause a lot of pain or discomfort. It should be pain-free, and based on research, they recommend doing about 5 sets of 45-second holds. And that's doing like a double leg partial heel raise. So you don't have to get your heels all the way up. You can do a small little lift off the ground as long as you're squeezing the calf muscles, and you want to try and do that in a pain-free state. And you want to try and do it 2 to 3 times a day when you're starting off. The other thing that research says is it actually estimates that you need a load of about 70% of your maximum capabilities of your tendon to tolerate. Okay, so you want to actually hold a weight when you do it. You want to hold 2 weights. You can have one hand on a barbell or one hand on the wall. You want to use a lot of load to actually kind of just really kind of manage that load and kind of learn how to tolerate it, but also like get it properly functioning and build up its strength and capacity to tolerate everything. Okay, so that's phase 1, right? Decreasing pain with isometrics. That usually is done until you're at a 3 or less out of 10 in terms of pain. And a 10 out of 10 is emergency room, 0 out of 10 is no pain. Okay, so you want to be at level 3 or under that. And if you're starting at a 3 or under that, you can move to phase 2, which we're going to talk about now. Phase 2 is improving strength with isotonics. Isotonics were shown in research to be just as important and as essential as doing eccentrics, where you're just doing the lowering portion of the heel raise. So these are just traditional exercises that include both the up and the down portion. They're specific to daily activities, like when you're walking, you're concentrically using your Achilles tendon, and you're eccentrically using, I got a mouthful there. So really what it is, it's heavy, slow resistance training. They call it HSR training based in the research. And all that means is that you're kind of going up nice and slow. So say you're gonna do a heel raise, you're gonna go up for 3 seconds, you're gonna lower for 3 seconds. And that's gonna really put a lot of load on that tendon to help it grow and help it kind of change its capacity to tolerate that load. So it'll get stronger, so to speak. We have to speak in simple terms. Okay, so that is really what you want to do. And again, you're doing this when you have a pain level of a 3 or a less out of 10. And you need to do it both in standing, because it's going to work your gastrocnemius, which is the big belly of the calf muscle. And you also want to do it in sitting, because sitting is going to work the soleus, which is the underlying outer part of the calf muscle. Both muscles are super important, especially if you're a runner, basketball player, volleyball player. You are using both muscles all the time. So both need to be trained in a set amount of time and detail. Okay, so again, tempo's 3 seconds up, 3 seconds down. What you want to do if you're setting up your routine and you're in phase 2 here with Isotonics is you want to start with heavy slow resistance exercise about every other day. Okay, then you want to do isometrics on the days in between those. So you can do 3 days a week of heavy slow resistance training, like normal heel raises with weight, and then you can do isometrics on those days in between for 2 to 3 days a week. And that's a great kind of way to build up good strength and to kind of increase that capacity to tolerate more load of your Achilles. Okay, so typically week 1 would look like 4 sets of about 15 reps. Week 2, you increase the load a little bit. If you don't have any pain and you're not super sore, it's about 4 sets of 12 reps. All right, and then you do that for about week 2 and 3, so that's 2 weeks in total. Then you increase the weight again, and you go to 4 sets of 10 reps. So you notice the reps are going down, but we're keeping the sets the same. And then you want to decrease the reps to 8 and then 6. So it looks like this if we had to recap. 4 sets of 15 reps, week 1, week 2 and 3, 4 sets of 12 reps. And then those kind of weeks that come after weeks 2 and 3, like 4 and 5, you're going down to 10 reps, to 8 reps, to 6 reps. So you're increasing the load, but you're also kind of decreasing the volume as you go along. And that's super important because you always want to change one variable at a time. You don't want to change too much all at once because then you're going to develop a lot of issues. You're going to overload your tendon. You're going to end up back where you were when you first injured it. So always change one variable at a time, whether it's sets and reps, or whether it's load, or whether it's how often or frequently you're doing it. Okay, so hopefully that makes sense. If it doesn't, comment down below. I'm happy to answer any questions you guys might have. And then we get to phase 3, the final phase here, recovering the spring with plyometrics. This is the hardest phase. This is like where everyone struggles to get to, where they struggle to kind of do these, okay? So we really need to improve the ability of the Achilles tendon at this point to kind of absorb and actually store loads, okay? So a lot of times, like when we bend down and we jump up, so we go into like a squat and then we jump, we're loading the tendon like a spring and then releasing that spring. Like think about a slinky going downstairs. It's kind of like that motion. So you want to start with depth drops. Depth drops just mean you're starting on a step about 6 to 8 inches high. You can use weight plates, like 3 or 4 stacked up, and you're kind of stepping off and landing on both feet in a mini squat. You want to not land stiff. You want to land nice and controlled. You want your knees bent to absorb the force, and you want to try and do 3 sets of 10 reps. When you can do that for a week, about a week straight, no pain or no issues, then you're progressing a little bit to about a 12 to 14 inch box. So you're increasing the height of the box. And when you can do that for 3 sets of 10 reps for a week, then you're progressing to single leg landings. So you go from double leg landings to single leg landings. That is the next progression. And before jumping, you want to make sure that the strength of that injured leg is about the same or equal to the strength of the uninjured leg. Okay, so if my right side is injured, I want it to be the same strength as my left good side. That needs to be super important. That's the most probably beneficial thing if you're going to take anything from tonight, that it has to be the same strength in order for you to jump, in order for you to run again. That is so important. We have different tools in the clinic to do that. We can measure like using these little tools, apps. We can use our hands to do manual muscle tests. All different things kind of work, and all different things should be used too. Okay, so after that, then you want to do single leg hops in place. You can just kind of use a jump rope. You can do single leg hops that way, or you can do double leg pogo hops, which is, use 30 to 50 reps. You can simulate jump roping where your foot's clearing the ground by like 1 or 2 inches. And that's a good way to load that stretch shortening cycle of that tendon. So it's like a spring. And you want to pay attention to really how that tendon feels during and after the workout. Okay. If the pain or stiffness is not present during or after the workout, that's a good thing. And that means you can increase the load. If the pain or stiffness is present during or after the workout, you probably want to decrease one of your variables, meaning you decrease your sets or your reps, or you decrease the load. Okay, you can even decrease like how long you're doing it for. All right, so remember that one variable. That's super important. Okay, so that's really kind of the end of the cycle. And when you feel really good and you get to that point where you're doing single leg hops without any pain, then you can start to get into light jogging where you're doing 1 minute intervals, 1 minute rest, 1 minute interval, 1 minute rest. All right, then you can find a return to running protocol. I love a good one from University of Delaware. I get no kickback from it. I use that because it's based on a lot of research with a lot of my clients, especially the runners that I have, or basketball or volleyball players, getting them back into cardiac conditioning, or I should say cardiovascular conditioning. I will give them that and they'll start to utilize that overall. Okay, so that is the 3 cycles. Just to recap, number 1, phase 1, you're decreasing pain with isometrics first. Again, you want to use a load that's about 70% of your max, and you want to do 5 sets of 45-second holds. Number 2, phase 2, is you're improving strength with isotonics. So you're doing normal double leg heel raises and standing and sitting to work your gastroc and your soleus, starting at 4 sets of 15, going to 4 sets of 12, to 4 sets of 10, to 4 sets of 8, to 4 sets of 6, okay? So you're increasing the load over time, keeping the volume very similar or less. Phase 3, you're recovering the spring with plyometrics. Again, you're starting with the depth drop, then working your way to double leg hops, single leg hops, then eventually getting back to light jogging, okay? So hopefully that's super helpful for you guys. That is really how you're supposed to treat a good Achilles tendinopathy issue. Unless it's chronic and unless you have like, you know, excess bone growth, calcification at your heel, which does happen, or you have like Haglund's deformity, then you might need to see the doctor. It might be a little more serious. You might have to get put in a boot for a little bit to unload it, get put in a heel lift. It just depends on your issue. And even though I'm giving you these exact tools and tips, and they do usually help 80 to 90% of people, like even though you have an Achilles tendon issue, it might not be the same as your best friend or your other friend. Physical therapy is not always black and white, and that's why it helps to get assessed so you know exactly what you need to do. I cannot stress that enough, okay? So we have one more ankle video next week as part of our Achilles tendon series, and that'll wrap up the month. If you missed the first 2, go back and watch them on our YouTube channel. Thank you so much for watching. This wouldn't be possible without any of you guys. So if you found this valuable, please hit that like button, subscribe to our channel. Please share this with one other person, especially if they're a weightlifter, if they're a runner, even a volleyball or basketball player, because those are the most common group of people who get injured. They could definitely benefit from this free information. And yeah, we will see you guys in the next video. Have a good one.